All right. Morning, everyone. Thank you so much for joining us this morning for our Equity in the Workplace series finale event. It's here. For those of you whom I haven't seen on these previous events or I haven't yet had a chance to meet in a meeting, it's nice to meet you. Sarah Moore, Legal Counsel and Business Development at Benefit Bump. I'm joined this morning by two of my Benefit Bump colleagues, Scott Liebman, founder and president of Benefit Bump, and Crosby Spees, Director of Operations. Putting the pieces together to create an equitable, family-friendly workplace can feel overwhelming. That's why we put this series together, to break it down into actionable items and steps, and to show you why it makes sense to put additional supports in place for your growing families. Although we are sad this series is coming to an end, we're excited to bring these topics together for you in a summarized, reimagined, and reformatted way so that we can help you distill down the key takeaways. So let's get started. So I just wanted to give everybody a little roadmap or overview of where we're going to be going this morning with our discussion, what we're going to hit when. So we put together an agenda. First, we're going to talk and give you a quick overview of our series and the speakers and topics that we covered in this series. And then we will cover key stats that highlight the need for additional support. And then we'll touch on various good, better, and best scenarios. If you're just wondering where to start, if you're trying to make sure your benefits are competitive, if you're focused on enhancing your workplace policies, and if you're reviewing your parental supports. We'll then move to the business case, how Benefit Bump fits into the picture, and live Q&A. But feel free to ask questions at any time along the presentation. We'll be monitoring the chat, so feel free to, we'll be happy to stop and ask any questions that you have along the way. But if not, we've got some Q&A time at the end. And also, before we get started too, I wanted to give a little Scott Liebman disclaimer that these slides are a little bit dense. We're going to try to move quickly through them, but there is a lot here. We'll make sure that you all receive a copy of the presentation when we're finished. So over the past few months, we've hosted a series of webinars with leading vendors and thought leaders to bring forth ideas to help improve equity and inclusion in the workplace. Each presenter shared data points to frame the challenge, shared recommendations for progressive benefit or policy improvements, and provided the case for change. And so we had 7 different sessions. We got to speak with Lynn Perkins, around caregiving resources and necessary supports, Cam Smith with CUNIC, employee resource groups, gaps, and different solutions in that area, return to work supports with Mindful Return. We had a session with Progeny around infertility struggles and possible benefits and next steps. Maternal mental health resources and why they're so needed for our low income population with Ann Wanland of Canopy, paid parental leave with Vicki Chabot of New America, where we are currently, kind of where we've come from along paid parental leave and where we hope to be in the future with new proposed legislation. And lastly, a session with Mama Va Nikki Kent, lactation support and how to pump up your mother's room. So that's kind of how we help to help solve for all the different pieces in the ecosystem to support growing families. And we get asked from time to time why an employer should solve for their growing family population. Why should we support our caregivers when there are so many different groups and populations to solve for? And so we thought we'd put together this graphic for you to kind of highlight the different populations and percentages so that you could sort of put the bigger picture together. And there are resources for each sort of these populations. So it's helpful to see the percentages of your population that are struggling with these different things. So to kick it off, 10.5% of the employees in US population are diabetic, 23% of the US population are smokers, 27% will undergo cancer treatment. And then moving into, again, these bigger graphics, these larger percentages, 66% of the population are caregivers, and 86% of women will have a child. So as you can see, there are absolutely resources for diabetics and smokers and cancer and different pieces. And we think there are business cases that probably help to solve for and make sense to solve for each of these populations, but just really wanted you to see the magnitude of caregiving population and women that will have a child. So it absolutely makes sense to solve for the growing family population. And when we talk about ROI, when you invest in parents now, you get the benefits now. So when you're helping a new mom return to work, she's really doing that pretty quickly. You're realizing that gain, or you're realizing that ROI pretty quick, within a pretty quick time frame. In addition to reducing prematurity, you're recognizing those healthcare cost savings in a very timely manner. And that may be different than solving for some of these other populations. And this is really why our series and our organization supports this population, because there are absolutely a lot of needs from your caregiving population, and they are a big percentage of your workforce. And so we wanted to drill down here at Benefit Bump. We know moms are struggling. We're hearing about it sort of as the pandemic has been going on with different things. But here at Benefit Bump, we wanted to understand the magnitude and specific needs and pain points of the working mom population. So we conducted our own survey, a working mom survey, with over 550 moms from across the United States, using SurveyMonkey and hitting lots of different ways we were able to get access to these moms. And the results indicated an interesting disconnect. So employers, we've heard from some employers that their growing family population, they're not struggling because the employers are saying, listen, we're not hearing from this population about some of their pain points. So it was really interesting for us to conduct the survey, because we did get a lot of pain points. If you look at these percentages, they're rather high, right? We know, because of the news right now, we know working moms are struggling with mental health and securing childcare. To me, this 85% number is just extremely high, of moms that are struggling during pregnancy and then postpartum with mental health. And if you compare the 85% of our moms that said they had a high amount of stress with EAP utilization, which is about 4 or 5%, there's still a huge gap in the mental health resources and access and utilization of those resources. In addition, 79% of our moms said that they had a difficult time securing childcare. Again, we're hearing a lot about that now, and that was also very much reflected in our survey. 64% of our working moms said they have a difficult time determining and applying for parental leave, maternity leave, and understanding their pay replacement, and putting sort of those different policies and pieces together. And then 57% of our moms had a difficult time breastfeeding when they returned to work. And again, these different pain points weren't shocking to us. Maybe the percentages were a little bit higher than anticipated, but these are the struggles that our own participants here at Benefit Bump are struggling with and that we're helping with, right? So mental health resources very much at the front door of what we're doing, making sure we're connecting to EAP, our licensed professional counselors on staff. With regard to childcare, we're finding that our participants have like a tenuous primary childcare plan put in place, and maybe we've helped them put that in place much sooner than they would have done without us. But backup childcare is still a place where a lot of working moms and working parents are not thinking about, because you kind of hope it doesn't happen. But unfortunately, with everything that's going on, I can speak to this personally. I have 2 sick kiddos right now with colds. Backup childcare is extremely important, so helping in that area as well. And then 90% of our participants are having a hard time understanding their leave and pay replacement, and can they stack vacation and PTO and sick time and all of that on top of a parental leave or a maternity leave. So we're answering lots and lots of questions around that topic. And then returning to work and breastfeeding, it's hard to understand where you go. How do you talk to your manager about it? Should you be blocking your calendar? How long is it going to take? What do you need to bring? How do you reserve the room? So helping moms with that as well. And the key to solving for those pieces is that you're then able to prevent the 26% of our working moms from the survey around the US that said they switched their employer with another 10% that left the workplace postpartum. So helping them solve for these different pieces then prevents them leaving, dropping the workforce entirely or leaving your organization. And so we just wanted to highlight, there were so many great sessions and so many stats, and I hope you all have found our key takeaway document really helpful, but we wanted to highlight some of the stats that were presented and shared. And I'll just, like I said, I know there's a lot, so I'll just go through a few of them that were shared during the presentation. So from our Urban Sitter event, lots of things that stand out, but really childcare responsibilities are the second highest concern of working parents, and that's right behind the work-life balance. Again, not shocking, we're hearing about it a lot in the news right now, but definitely a large concern for your growing family population. From our Mamava event, only 40% of participants have access to a private space other than a bathroom to pump. And I have pumped with both of my kids, and I can't imagine not having access to a private space to pump, whether you had to go to your car or in the bathroom. Clearly, there's a need there in the workforce to create access to more private spaces. With our session with Canopy and low-income moms, we discovered that low-income moms are 11 times more likely to struggle with mental health issues and are far less likely to access support. So again, there's definitely still a gap in your low-income populations to maternal health, mental health resources access, and making sure they're getting the support that they need. This stat I found on the left side of this graphic particularly interesting, and again highlighting a gap. So our session with Kunik with regard to employee resource groups found that 76% of caregivers want an employee resource group, but only 9% belong to one. So when we talk about, and Scott's going to cover soon, low-cost ways to make meaningful change for your organization and your employees, an employee resource group can be a great way to do that. And again, clearly there's a gap and a need. From our session with Mindful Return, we discovered that 50% of new moms struggle with return to work after maternity leave, and that's for a whole host of different reasons. But I also wanted to highlight the middle stat in that graphic is this thought around the manager lottery. And so when you don't have flexible work policies that are documented, you're essentially leaving your employee population to what's called a manager lottery, where they'll have a good experience if they win the manager lottery and have a great manager. So the idea is, let's record these policies, have them utilized by all, and message to all your employees so you're not relying on your employee winning this sort of manager lottery. And lastly, from our session with Progeny, Winnie was able to highlight a stat that 1 in 8 people struggle with infertility. And I think that's a much larger percentage than a lot of us realize, because it's not exactly talked about in sort of the workplace setting. So definitely have a number of your growing family population and your employee group that's struggling with infertility. So we asked presenters for good, better, and best solutions to improve benefits and employee supports in these areas. And most of what they've proposed are relatively low cost and easy to implement solutions. And I'd like to turn it over to Scott to walk through that next part of our discussion.
All right, thank you, Sarah. So I appreciate you pointing out at the beginning that I do love dense slides. So those of you who have worked with me before know that I try to use all the space. But what I want to just cover in the next 10 or 15 minutes is just some thoughts that our presenter shared with us around things that employers can consider now to improve their family-friendly benefits or their supports for working parents and growing families. So we divided into a few sections, one being competitiveness of benefits, another being policies and practices, and another being workplace supports. So I'll start with competitiveness of benefits. And I think one of the most challenging things probably for everybody on the phone is, as an industry, and probably a lot of industries are similar, we love benchmarks, but we're kind of getting into a space where expectations are changing materially as it relates to, the new entrants into the workforce and maybe a little bit of an arms race around certain benefits. And so benchmarks may at best be a trailing indicator. So that was why it was important for us to work with these partners in this this speaker series just to try to figure out like what should that target be for employers. So around competitiveness of benefits, and some of it will depend on your organization, but some good options to think about are simply adding coverage. So if you don't already have fertility benefits or adoption support benefits that allow more paths to parenthood, something to consider. Paid leave programs have a multiplier effect. So probably for each dollar you may spend on a paid leave program, you're going to get significantly more than that back in improved perception. Because one of the fascinating things is in a given year, you might have less than 5% of the population use parental leave, but it'll still be rated as one of the most important benefits by a much larger percentage of the population, and especially by candidates. Disability pay is an interesting one. I know there have been a lot of arguments around, well, why would we treat pregnancy different from other conditions? But it is something that naturally occurs in a lot of lives. It affects a lot of people. And it just might be an area where that increased investment will have a much higher return. So a simple thing, if you're not already doing it, is simply allowing people to top up their short-term disability to get closer to full pay replacement. We've worked with a number of participants already that have shared with us that, you know, getting cut back to say 60% pay does create a hardship for their family, which impacts the amount of time that they'd be able to take off to recover and bond with their child. If you want to get a little bit better, one of the things that we learned from our discussion with Progeny, and something that seems really logical, especially as employers embrace inclusivity, is relook at your fertility policy. I was looking at one this morning that required 6 to 12 months of heterosexual sex, depending on age. And it also required 6 to 12 attempts at artificial insemination. And so the fact that it required a diagnosis of infertility and a lot of steps in between makes a benefit both difficult to access, less valuable, and less inclusive. From a paid leave perspective, you know, we think it's important to strive for 12 weeks of paid maternity or parental leave. And a lot of this is backed by the science. So there's been a lot of research that's indicated that time to bond actually has material positive impact on mental health, physical health, and it improves retention. So it's something that creates a better environment for somebody to come back and support their company. And then kind of a next step up on disability pay would be to actually carve out maternity and provide higher income replacement for maternity. And then just in terms of kind of a best that was teed up is, again, kind of following the different categories, but for fertility, cycle-based benefits feel like a best practice because it doesn't put somebody in a position where they could run out of benefit mid-treatment. And the concern, and this is something that I've talked to clients about for a long time when I was on the consulting side, is it's a good thing to do for your population, but it's a great risk mitigation strategy as well. So when folks run out of money or they don't have a benefit available, they're more likely to have multiple embryos implanted, which leads to a higher probability of multiple births, which, you know, are more likely to be premature. And that's where you have these catastrophic claim events that you can avoid through a well-structured fertility benefit. And then, you know, taking paid leave to the next level would be providing family leave, so that way you could extend to all caregivers and not just new parents. In terms of, you know, affirming your policies and creating consistent approaches, Sarah alluded to this, and almost everything on this page is free. Like, these are just things that take a little bit of time, but don't require additional investment. But one of the things that we commonly hear from participants is they really don't know what their options are. So they don't know whether they can phase back into work. They don't know if they can move to part-time. They don't know how to leverage intermittent leave. So there are a lot of things that they don't know, some of which is created by the conversations that they might have with coworkers or their manager, who also might not know what the policies are. So we did a survey at the beginning of the year asking employers, which we had 102 employers respond, whether they had formal return to work policies, and less than half had a formal policy. So this is just what I think is low-hanging fruit. Sarah also mentioned earlier, just providing accessible private spaces to pump. That might be harder for some of you than others if you have a retail footprint or depending on how your offices are structured. But we'll hear from a lot of people that they've got to maybe borrow their manager's office, or maybe the pumping facilities are such, or the mother's room is such that it's hard to figure out when it's going to be available. And so there's a lot of opportunity here to improve what's available. Another thing that came up in our mom survey was quite a few people wrote in that they were really disappointed in their employer because they felt like having a baby became a burden to their boss or their coworkers or their employer. And what they really want is their employer to celebrate it. And one way to celebrate it is to encourage people to take advantage of the benefits that you're offering and investing in, and encourage both men and women to take leave to bond with their child. And then, what we heard from Mamava was, providing a designated non-multi-use space is an even better practice for pumping moms. And so this, doesn't put them in the position of needing to use a shared space or borrow a manager's office. And then what we think is best practice from all the conversations that we've had is really structured phase out and phase in programs for new parents where, and I think there might even be somebody on the phone that has this in place currently, but go ahead and pre-declare how that return happens. So maybe somebody comes back to work on a Thursday of the first week and they work 2 days, and they come back for 3 days the next week and 4 days the next week, but something that allows them to ease back in, work with managers on training so we're not basically dropping somebody back into the role at full speed when they get back to the office. And then another, what we think is best and hopefully a low cost solution is there still are quite a few employers that require employees to clock out when they're pumping. And that might be just a really inexpensive, mom-friendly approach to getting rid of that. Because what we're hearing from moms in this category as well is folks are trying to figure out how do they structure their schedule if they have to get 8 hours of work in, plus they need a pump maybe twice during the day, and then any other breaks. And so it definitely is creating anxiety for individuals. And then in terms of parental supports, this really kind of comes down to how you leverage mental health, childcare resources, and employee resource groups. And this is really where good is promoting what you already have or creating ways for people to connect. So destigmatizing EAP, making sure people know where to go to get certain information and to get certain help. Better is something we're seeing a lot in the market now with employers adding backup childcare programs to their array. We invited Urban Sitter to this conversation because we love their model. They're peer-reviewed, background check providers. It could be structured in a way that employers pay as they go, versus pre-commitment, and it's a cost-plus model that's less expensive than some of what existed before. So if you haven't taken a look at your backup childcare program, it probably makes sense to look at your options. One of the other things that we've heard a lot, and there's been a ton of media attention about this, is just the lack of availability of mental health providers. And especially when you look at mental health providers in a medical plan network. So if successful mental health providers don't have to take insurance because they could fill their panels, then we're just shrinking the supply progressively, and it's going to get worse as our need for mental health services grow. So it might be time to relook at how you structure your medical benefit to make sure that people can access providers regardless of network. And then in terms of connection, the next step up from an ERG would be mentoring programs, ways that you really create advocacy versus connection within your workplace. And then we think best practice is truly having transition planning, return to work support, and making sure people understand everything that's available to them and how to get it. It's interesting because over the last few days, I've talked to brokers, insurance company folks, and employers. And I would say that there isn't anybody I've talked to yet who doesn't believe that our current leave infrastructure is borderline a disaster. It's been streamlined to where it's really difficult for people to get service. They can process a transaction, but they're not getting support. And there's a whole lot more that goes into returning to work than simply a phone call 1 week before that return date. So this is a huge area of opportunity, something that we can definitely help with, but something employers could change as well within their own internal structures. And then, pump up your mother's room. And I know Sarah feels super passionate about this, and I think she almost grabbed this whole section from me just for this point. But I think she mentioned it earlier, but look at the mother's rooms you have today, and if they're just a sterile room with the chair, then there's probably room for a little bit of improvement for less than a couple $100. And then provide enhanced maternal health resources. So I think we've moved past the legacy healthy pregnancy program that's reactive and limited in nature, but think about what else you can do. And that's where we just love Canopy, because what they're doing is they're filling a gap around accessibility and affordability around mental health. And so definitely something to check out as you're evaluating vendors is really the level of specialized attention available. So as we mentioned, we're going to provide these slides, so you'll get all of these comments. So though I've read the last 3 slides to you, I won't read this one to you, but we just tried to pull it all together into like, where would be a good starting point? And so this is just a series of different things to consider, most of which are low cost, some of which have a little bit of cost, but definitely a high ROI. And maybe can give you a roadmap to start revisiting how you're supporting working families and growing families, because the trade-off or the return on investment we think is pretty tremendous. And that's what I'm going to have Crosby cover in our next section. So then I'll turn it over to Crosby.
Great, thanks, Scott. So we've established what the pain points are for working parents, and we've established what employers can do to respond to those pain points. Now I want to take a minute to turn to why should employers respond to these pain points? Why employers should implement these good, better, best that Scott's laid out. And it really comes down to primarily your talent acquisition and most importantly, your talent retention. So speaking for myself and my peers for a moment, I'm not a parent right now, but I hope to be one day. And when I do become a mom, I hope, and honestly, I expect that I can continue to have a thriving and successful professional career and be a present mom to my kids. And as I speak for myself and my peers, and we look at our current employers and what the next 40 years holds for our professional careers, we expect to find organizations that support and celebrate us pursuing these 2 identities simultaneously, that of a valued employee and of a caregiver. And if you look at your talent pool, your incoming talent, that's exactly what they want too. Your incoming talent pool, your Gen Zs and your millennials, place a higher focus and a higher value on benefits and corporate culture that support employees as a whole person. We see with this first stat under talent acquisition that 68% of millennials look for family-friendly benefits. That includes your fertility benefits, your paid parental leave, etc. We see that 96% of employees need flexibility. And finally, we see that 80% of employees looking for a job look for a company that values diversity, equity, and inclusion. And I want to stick on that DE&I point for a second, because if we look more specifically at your millennials again, who are right now the largest group in your workforce, we see that 2/3 of millennials believe that their employer only pays lip service to DE&I efforts. That means your incoming talent pool and your current largest group of your workforce is looking for tangible solutions to DE&I pain points. And you can start by supporting your working parents. So now I'll move on to talent retention. So let's say you found and brought on that highly valued and skilled talent that we know right now is in short supply for employers. You need to ensure that support systems and benefits are in place to help them stay and to make them want to stay with your organization for the long haul. We know that turnover is incredibly costly to employers. There was a Gallup study that found it costs between 1.5 to 2 times an employee's salary to replace them. And that's just the financial cost. Voluntary employee turnover means losing your reliable winners, your constant innovators, and your most effective problem solvers. And we know that our working parents are some of our most valuable employees. A Bright Horizons study found that about 91% of working Americans agree that working moms bring unique skills to leadership roles, and 89% believe that working moms in leadership roles bring out the best in employees. That same study found that working moms are believed to be better listeners, more diplomatic, calmer in crisis, better team players, better at time management, the list goes on. And for any working moms on the phone, I'm sure you know this to be true. But the problem is when you don't have support systems and you don't have benefits that are set up for your working moms to stay, your organization then suffers. And as Scott and Sarah both alluded to earlier and talked about earlier, our 2020 mom survey found that working moms are leaving their current employers and they're leaving the workforce. It found that of those moms who left, 65% left due to poor work-life balance, 48% cited a lack of flexible work arrangements, and 34% cited poor support from their managers. So the problem is clear. Working parents need support if you want to keep them in your organization. So your highest opportunity here for ROI comes from your talent acquisition and retention, and especially your retention, keeping your current talent pool and keeping them satisfied and fulfilled with your organization. But there's also a business case for improved productivity, reduced absenteeism, and lower claims costs by enhancing your family-friendly benefits. And these enhanced benefits that we've talked about through the whole series and that we've talked about in this recap session, they're not luxury items, but they're practical, high return business decisions that will provide immediate return, as Sarah spoke to. So starting with prenatal stress. There have been studies since around the 1950s linking the impact of prenatal stress to preterm birth and birth complications, which all can lead to higher claims costs. Providing proper fertility services and maternal mental health services can reduce these claims costs. Then moving on to perinatal mood and anxiety disorders, PMADs, they also drive a high claims cost. A 2019 Mathematica study found that the cost of untreated PMADs is about a little over 14 billion annually. And then finally, childcare. We know childcare and childcare disruptions can cause a huge issue for productivity for working parents. Nearly half of working parents miss an average of 4 days of work every 6 months because of breakdowns in their regular childcare plans. When you have backup childcare services and you have backup childcare subsidies, you can reduce this. So I really hope through this entire series and through this recap session that we've conveyed that there is a huge opportunity for ROI and a huge opportunity for immediate return on your investment when employers enhance their family-friendly benefits. And honestly, that's why we created Benefit Bump. Benefit Bump helps employees feel valued, included, and fulfilled at work. Through our main pillars that you can see here, project management, emotional support, and advocacy, Benefit Bump is able to improve your return on investment when implementing any of the enhanced benefits we've discussed through our equity series. We deliver in-the-moment emotional support through a dedicated care navigator. And we address the top concerns for new and expecting parents, including pay and security, childcare plans, leave planning, and transition to and from leave. When we look at some of our current clients, we've had a few clients who have rolled out paid parental leave with Benefit Bump, and we've seen a high immediate engagement among participants seeking to learn information about both of those benefits, speaking to the effect that Benefit Bump can have when rolled out together. As you can see on this slide, and I won't speak to everything because like both Scott and Sarah, I'll echo what both Scott and Sarah said, we like busy slides, but we'll deliver these slides after. But as a business, we're really focused on improving benefit delivery, and we can help you structure better policies and better deliver your benefits to retain your working parents and to get the maximum return on your investments. And like I said, I'll leave this slide up here, but I do just want to finish by saying, truly one of my favorite parts is we talk to clients, we talk to prospects, we talk to just people, about Benefit Bump in general, and we run through the program and what we do and how we deliver it. One of my favorite things to hear is that this is finally the program we've been looking forward to pull all together. So with that, I will turn it back over to Sarah. Thank you all for your time today. And Sarah, I'll turn it back to you.
Thanks, Crosby. Wow, what a way to wrap it up. And for those of you that we'll move to our Q&A session. So for those of you that have been sitting on any questions during our presentation, please feel free to ask now in the chat. I will start with a few questions that were emailed to us ahead of time, but please, if you have any questions as we were going through it or now as you're sitting here, feel free to type them in the chat. But first, Scott, I think this question will be for you. So congressional Democrats are attempting to use the budget reconciliation process to pass the $3.5 trillion human infrastructure plan. If the government is going to pay for family and medical leave and provide childcare, what does that mean for companies that are currently spending money on these things?
Yeah, no, that's a great question. And kind of with our politics, it's hard to see or hard to predict what will happen until it's actually crossed the finish line. But arguably, it's just a great opportunity to reinvest. So if you're an employer that's already providing benefits that are ultimately going to be subsidized through these programs, it could free up the money that you might want to invest in some of the other things that we've talked about today. And then, probably the other piece, and I think this came up in our meeting with Vicky Szabo, is it's probably going to put a little more pressure on some of the folks on the phone to figure out what's next as they're trying to compete for talent, because it does have the potential to kind of level the playing field a bit as it relates to time off or paid time off.
Yep, that makes sense. Well, I have another question that was emailed to us ahead of time. So Scott, this one will be for you as well. And again, if you have a question, feel free to put it in the chat as we're going through some of these. But so Scott, if you had to pick one area to focus on, there's a lot of different steps and things to consider and action items that folks can take away from this series. But if you're going to pick one, like what can I do tomorrow? What are one or two things that I can focus on immediately, right away, right now? What would that be?
Yeah, I mean, I guess I probably pre-answered this with my comment about the leave process being a disaster, but I think that's the key. It was really interesting as we were building Benefit Bump and through the survey work that we've done to hear how many people took that bad experience and extrapolated it out to other issues with that employer. So when people don't feel valued, when they don't feel like they're cared for in a way that they expect, it leads to high turnover. And there's just a lot of room. I had one of my former clients call me out for a placement I made for their leave administration where the RFP and the presentations all sounded great. And then, as people started using the benefit, they found that almost everything was done through audio response. And it really was in conflict with the culture they were trying to build. So I would invest in the leave process. I would really dig deeper into how to support that. And then second would be paid leave. Even though the government may pick up some of this expense, it just has that multiplier effect. It's something that people really value, and definitely something employers should look at to make sure that they're not missing out on talent or losing talent over something that might be pretty affordable to offer.
And two more things, Scott, that you mentioned kind of as you're going through good, better, best, optimizing something that you can do sort of right now that's low cost is optimizing what you already have. So connecting to EAP, how we message it, where does it live, and sort of an employer's ecosystem, how do people find access to it? So that's just one example of ways to kind of optimize what an employer already offers. And then I love updating the policies because we talked about really making sure and solidifying and being proactive about those policies are sort of low cost ways that employers can kind of take actionable steps right now. So I just wanted to hit those two as you already mentioned them. And it looks like we have a question in the chat, although Susie, I see that you responded, but maybe we'll serve it up for the whole group. Let me scroll to it. It says, this is from Cal, does Benefit Bump provide resources for expectant and new grandparents too? After Susie, you wrote an article for CFMA, Cal heard from some industry professionals who are seeking to better support their families with fertility challenges, miscarriages, and pregnancy complications. And it looks like Susie, you teed up our microsite, and we're also, Cal, we have a microsite for perinatal grief and loss, and in addition to that, are launching this week, tomorrow, I think, our shared space group that creates sort of a community, a private community for those that are struggling with perinatal loss as well. But Scott, any other thoughts on Cal's question?
Yeah, I mean, so the way we've designed Benefit Bump is we assign a client code to each group. So if a grandparent called and wanted to talk about, the what to expect or wanted to provide some additional advice to their child as they're navigating the process, we'd be happy to share some thoughts and resources. So far, we haven't had grandparents call, but we would not turn anybody away.
All right. And please, again, feel free to share questions in the app. Cal, thanks so much for the question. That was a great question. And so one of our last pre-emailed questions that we have is, what's a good next step for a company looking to provide childcare support? So Scott, I know you mentioned the backup childcare, but what, if a company is saying, listen, I know my employee population is struggling with childcare right now, what can I do what should I be thinking about in the next few weeks as to how to better support them? What are your thoughts on that? And then I can speak to any personal experiences, but yeah.
Yeah, no, this one definitely is a place for somebody to take the lead. So right now, I think we rely on EAP, and the sad reality is that if most of you pull your EAP report, you'll probably find almost no utilization of the EAP for childcare resources. And part of it is as we're loading clients, setting up clients, that the access within their websites is not super clear, and a lot of times they're taking people out to childcare.gov. So, we think best practice is probably creating that concierge role. It's something we do. I don't know that there are a lot of others that do it. There are some organizations that are adding that as a role within a benefits team. And then the other thing that I would start to think about is income-based subsidies for childcare. So I don't think I've had a conversation in the last month or so with an employer that isn't having trouble with recruiting and retaining talent. And so I think there are multiple ways to respond to it, and probably the most popular way is through pay. But this really is a chance for innovation, and it's a potentially tax efficient way for you to deliver something that enables families to return to work. And so if you haven't thought about subsidizing caregiving, it might be worth modeling out and maybe put some guardrails around it as it relates to your investment, or and the population that would be eligible. I think, Sarah, you might have some practical advice too, and I think you kind of alluded to it earlier around the complexities of childcare. So
yeah, it's hard right now. So, for me and my 2 kids that are sick with a cold, all of the sort of daycare and preschool protocols kick in, and everybody automatically thinks it's COVID. And so you have to keep the kids home. And then maybe some of those backup plans that you had in place fall apart because family members are also maybe thinking it's COVID and they don't want to watch your kids. So really, for me, we had to test them as soon as possible so that we could rule that out. And I think the key, and this is hard to apply to all employees, so it is hard for employers, but giving your employee the flexibility so last night I worked some at night because during the day it was kind of mass chaos at our house. So giving your employees some flexibility as far as when they can work, and really just being understanding. And I think understanding that these especially return to work and return to school times are times when your employee population, your caregiving population is going to have sick kids. And so being very flexible and mindful of that, I think, is key. And again, it's hard to do for all positions. Not every position can flex like that. So I do understand, but for those where there is possible flexibility, giving it to your employees so that they can work when they can and when they need to, it's available. And then documenting that too, so it's super clear.
So I want to call out Malcolm's comment about women being simply better and him being okay with that. So we did an event with Amy Henderson earlier this year, and she had cited some research done by Ruth Feldman at Yale that indicated that men or non-birth parents that are given time to bond with their child will have similarly positive neuro effects and make them better leaders and better collaborators and better listeners. So there's opportunity for men as well, which kind of get to some of our comments around, gender neutral policies, encouraging men to take time off. But just a lot of upside available from supporting parents and really helping them feel valued and included, and definitely will translate into engagement and retention. So
All right, well, yeah. I did appreciate that comment, but no, I totally agree, Scott, that there's lots that the non-birth parent, regardless of gender, can contribute and lots of ways that their brain grows and that they are able to contribute to the workforce as well. And I just appreciate that was sort of our last pre-emailed question and the last question that I see in the chat. So I want to give folks maybe another sort of 20 seconds or so to regroup, and if there's any question, we promise we won't judge for silly questions or anything like that. Happy to answer any and everything, but I also just wanted to thank all of you for joining us this morning. We know that your schedules are really busy, and the fact that you're coming together with us and really thinking through how to serve this population and solve for some of the pain points and struggles should be celebrated. So thanks for joining us this morning. This series has now wrapped up, but we are going to come up with another series. We're super passionate about helping employers solve for different pain points and continue to keep their eye on the ball for those things that their employees need. So we will come up with a new series and invite you all, and we look forward to sending that out to you and seeing you on our next series. And thank you, Cal. I'm glad you found this helpful. Thank you, Malcolm. All right, I'm not seeing any more questions. So as sad as I am to say that the series might be over, it's been great being with you all. Thanks.